Well, you know, I'm actually thrilled to be able to present at this conference because we have an enormous problem that has not been effectively addressed, which is our obesity epidemic. And it's not just obesity, but it's an epidemic of diabetes and obesity. We call that diabesity. And the concept here is that 1 in 2 Americans suffer from an illness of which 90% don't know they have it, but is the major cause of heart disease, cancer, and diabetes, and most chronic illnesses in this country. It's going to cost our country $3.5 trillion over the next 10 years to deal with this. And it's astounding that we don't have a clear solution that's provided by our healthcare system, because doctors are not trained how to deal with this. Insurers don't pay for it. The government doesn't create any policies to support changing our practices. Science isn't really looking for solutions that are non-drug based, which is really what we need. And so there's an opportunity really to create a model for treating obesity and diabetes and the whole continuum from imbalances in blood sugar to full-blown diabetes with a comprehensive model that's a lifestyle model, but also deals with a lot of surprising things that lead to obesity and diabetes. You know, what I'm excited about sharing is all the unexpected things. For example, like toxins may make us overweight, or that gut flora play a role in our metabolism, or that inflammation from any cause, whether it's food sensitivities or infections, may drive weight and obesity. So a lot of the things that we come to believe, that if you just eat less and exercise more, you lose weight and fix diabetes, are actually flawed. And that some of our underlying assumptions are flawed. And that there's actually a new science of systems biology applied to metabolic syndrome, diabetes, and obesity that'll give people an understanding of actually how to treat this in a practical way that deals with the underlying causes instead of just the effects. You know, some of the exciting things I'm going to share are that a lot of the drug treatments that we've been using for diabetes actually don't work or actually kill people. So recent, for example, study in the New England Journal just a few weeks ago showed that people who had intensive blood sugar lowering with diabetes actually did worse. It's called the Accord study. There are other studies where we've taken drugs that are meant to lower blood pressure, lower blood sugar, lower cholesterol, and showing that they actually don't reduce risk of death or bad outcomes in patients with diabetes or metabolic syndrome. So we're treating risk factors, but we're not treating causes. So what I'm going to share is a functional medicine or systems approach to dealing with the underlying causes of obesity and diabetes, and provide a solution, a roadmap for practitioners to actually fix this problem. And the other thing I'm excited about sharing is that we begin to understand that it's not just about the biology, it's about the sociology. It's about the social, environmental, and economic conditions that drive an obesogenic society, that create the defaults in the choices we make that lead us to behaviors that don't support health. And that part of the change that has to happen is not just getting the biology right, but is getting together, that is healing through community, that is using group support and tools and strategies to actually change our biology in ways that we can't do alone. And that's some of the most exciting research out there, because what we need to know is that it's not just about finding the right drug or the next treatment or the next research advance. We don't need any more research to know how to fix this problem. We don't need to do any more studies to know how to fix obesity and diabetes at this point. We have enough information. We just need to apply the model that we know exists in the science, the systems approach and the social support network approach. And those two things can be a phenomenal lever to shift the tide of driving disease and obesity in the 21st century.
Thank you.